Welcome back to Local 3 News. It's Aspirus Medical Monday, and joining us via video chat is Shannon Handler, a family medicine nurse practitioner with Aspirus. Today we are talking about caring for someone, whether it's yourself or a loved one with COVID-19. Is there anything helpful that people could take if they have the illness?
There's some evidence that some at-home things like vitamin C, 500 milligrams twice a day is helpful. Vitamin D is definitely shown to be helpful. There is some discrepancy whether it's 2,000 or 4,000 units per day is helpful, but they know that taking vitamin D is helpful. Some green tea has been shown to help reduce the length of time that you're sick. And zinc was the other one. I've seen everywhere from 50 milligrams to 100 milligrams.
And what about diet?
The deeply colored fruits and vegetables because of that antioxidant effect. So that's very helpful for reducing or fighting, your immune system boosting up to fight off any virus. So avoiding alcohol, trying to stay away from the fried foods and that stuff that are that actually increase your immune system or inflammation in the body.
What should people do as they try to recover?
Biggest thing is trying to get your rest, trying to get your fluids, and then eating as much as far as colorful as your body would tolerate. A lot of people really don't have a lot of appetite because your sense of taste in some people is gone, sense of smell isn't good, and that really decreases their appetite. So just doing what you can to eat for your health then. It's a little less eating for pleasure and more eating for what you need to get into your body.
Is there an effective way to decrease the spread of COVID within a household?
It's very effective for you to wear a mask, actually, in your house. We've had lots of people come in whose family members got sick and only one person in the house got sick. We've also had, people come in where everybody in the house got sick. So it is very effective to actually mask and try to social distance a little bit in your house if you're able to.
When should people with serious COVID symptoms consider going to the doctor?
If you see someone who is working so hard to breathe that they can't speak more than a few words, so if they're speaking and they need to stop and take a breath, like every couple of words, because they're breathing so hard, that's a good time that they probably need to go into the emergency room for evaluation. And if you've got one of those home oxygen monitors, we actually found that if it's going below about 93%, in a person who normally has really good oxygen up in 98 and 100, 93% is where we actually start to see some of the problems from COVID start to happen. Like some of the virus actually can worsen because of hypoxia. So like when you don't get enough oxygen, that's one of the stages where it's a kind of a critical moment of where things could get worse very quickly.
Thank you, Shannon. Sports is up next on Local 3.